Safe access to abortion is important because it's basic health care. This isn't something anybody plans to have. It's something that comes up that they need as part of their routine reproductive health care. And it's essential that it be where people live and in the communities that they're a part of. Safe abortion access is essential, and it can really make a big impact on not just people's quality of life, but the length of their life as well. As an abortion provider and as a health services researcher, I've seen really tremendous changes both in Oregon and nationally since the overturn of Roe versus Wade. At OHSU, we've seen the number of people coming to seek care from us double, not just in people from Oregon, who we've always taken care of, but people from neighboring states and really across the nation.
In Ontario specifically, there wasn't a place necessarily to go outside of the county health department. So we could have people traveling, 250 miles each way just to receive abortion care or, miscarriage management. It's difficult to do. Being able to walk into a clinic and get your needs met in a couple of hours is so important because, it could be that that's the only access point you have and that's the only amount of time you've got.
I think what's really frustrating for other OBGYNs and obstetricians like myself is we're seeing that, we spent 12 years in training after high school to be able to take excellent care of women and people capable of pregnancy. But what we're seeing now is we've got lawyers, we've got judges, and we've got politicians that don't know anything about medicine trying to tell us how to take the best care of women. I'd say that some of the people we see that are having the hardest times accessing care are people that have recently migrated to the United States or have been trafficked, and unfortunately a large number of those are people who are Latine.
The Ontario population is at 30+% Latino or Hispanic. Some might have lack of trust due to immigration status. Many folks might fear that giving information or somebody knowing where they live or who they are, that it might be a threat to their status here or them living here in Eastern Oregon.
You don't want to open a clinic where you have staff who are scared to go into work. We were really nervous initially. We went in and talked to lots of different community members. We met with folks who were clearly not interested in having us in Ontario at all. We met with folks who would say, yes, we need your services, but we don't agree with you, but we did it. And whenever we can do something to help folks feel respected and welcome in a space, whether that's by having bilingual staff, which we have, or providing additional services like patient navigation, what we really need are more Latinx folks getting into healthcare and the medical field. We need more people who understand where folks are coming from, who can provide care that is meaningful to those people without judgment.
Access to reproductive health care or any health care, really in this day and age, it shouldn't matter what language you speak. Every clinic, every provider should be working with high quality interpreters and be able to provide linguistically and culturally competent care.
Instead of putting all your energy into an unborn child, put your energy into the youth we have here now. We invest in our communities, we invest in our schools, we invest in the aquatic center to get that back open, where kids that we have here now, they have a place to go, they have healthy relationships with folks. That's where we put our emphasis and our energy into creating a better community. That's the dream.
We know that we're making a difference because we're talking to the patients and they're so thankful that we're here and providing non-judgmental care.
All of us deserve the right to evidence-based, unrestricted healthcare that's patient-centered and helps understand and meet our needs based on where we're coming from, and that's culturally competent and that addresses our concerns and is freely available in our community.